Mood changes can be quite normal, depending on one's current situation in life, right? I mean, one minute you are bubbly and dancing around, and then you hear sad news, or even see something unpleasant on social media, and begin to act all withdrawn. It happens all the time. So how then is a whole disorder built from this everyday experience? Welcome to our channel, where we talk about the journey to self-development. If you're new here, we trust you're going to love this video. And if you're a subscriber, thank you for coming back. It's great to have you all on today's episode, which is going to be a really eye-opening one, especially because of the sensitivity that usually surrounds it. Most people out there are curious about this illness, but you hear them go, "I'm really sorry to ask," or something of that variation, when they need to ask someone who's bipolar about the condition. And it's quite understandable, because people are actually afraid not to come off as offensive, and need to be extra careful before posing the question. Some others don't even bother because they consider the topic a no-go area, and prefer to hold on to their assumptions, which of course doesn't help anyone in the end. As someone who's engaged with a few people with bipolar disorder in the past, I can tell you that there is a lot more to it than what most people consider mere mood swings. And I'll be talking in depth about that today, as well as sharing a few coping tips towards the end of the video, in case there is anyone out there struggling with bipolar disorder, or trying to help a loved one manage it. The most significant distinction between the mood swings you experience and those someone who has bipolar disorder deals with is that theirs is often unprovoked. It is often without a particular cause, and the experience itself is much more intense than your average mood swing. These are not mood swings that simply last a few minutes until the next good thing starts to happen. Rather, the mood change can be so severe that it negatively affects the person's life. From their relationships to their career and all aspects of their emotions, people dealing with bipolar disorder may find it tougher to live a normal life because of the frequent shifts in mood they experience. These swings sometimes last weeks, and the whole time the person is feeling sad, disinterested, and just in their own world. Mania is another aspect of bipolar disorder that makes the condition much more serious, and it can present itself in different contrasting forms. So a person with the condition might be experiencing so much euphoria one day, and the next, it's restlessness and increased agitation. Before we dig deeper into the experience and behaviors associated with bipolar disorder, let's discuss a bit about the different types so it's easier for you to understand as we move further into the topic. Essentially, there are 3 types of bipolar depression, and the first is bipolar 1 disorder. Several maniac episodes accompany this kind, and it sometimes goes on for weeks and may be severe enough to warrant hospitalization. People with bipolar 1 may also experience a mix of mania and depression in quick sequences, so that's another symptom to look out for. Bipolar 2 disorder presents itself a bit differently, with episodes of depression that are split by symptoms of hypomania. Think of hypomania as a milder form of mania. These symptoms are usually milder than those that accompany bipolar 1 disorder and last a few days at most. Cyclothymic disorder is the third main type of bipolar disorder and is rarer compared to the other 2 kinds. People with cyclothymic disorder experience emotional highs and lows that can persist for months when it does occur, but this mood disorder is, however, not as severe as bipolar 1 or bipolar 2 disorder. Hey, if you're enjoying this video so far, please hit that subscribe button for more content about self-development and improving your life. It really helps our new channel, and your kindness will go a long way. I think the best way to understand what a person with bipolar disorder might be going through is to see how the illness affects what would otherwise be their normal life. Beginning with school and work, we all know how hard it can be to concentrate on days when your body is tired. Depressive episodes come with emotional weakness, which of course manifests physically. This means that sometimes there is no motivation to get up in the morning to prepare for school or work for a bipolar person. Maniac episodes might include symptoms like racing thoughts and agitation that bring about restlessness. In these episodes, manic or depressive definitely affect their performance at work, such that they have trouble completing even the smallest tasks. Building relationships does not come as easy too, and it often has less to do with the bipolar person not getting support than it has to do with their loss of hope in their situation. They are constantly worried about how friends and family might be tired of providing support and really just begin to feel like someone else around them is losing hope. For instance, it is not unusual for people with bipolar to completely ignore those they care about when their manic episodes begin. And it's not as though they really want to do this, but they're simply thinking, who wants to be bothered by my own problems when they have enough of their own? Another aspect of bipolar disorder you may be unaware of is the spending habit, or generally how diagnosed people handle money. And this may not apply to everyone with the illness, but from my observation, there tends to be this urge to go on a spending spree, especially during manic or hypomanic episodes. A person with bipolar disorder may run into debt from this spending habit, and what is most interesting about it is that the spree may be fueled by a kind of obsession. Say, a weird idea of doing the world so much good by purchasing expensive supplies. All of these keep pointing back to the fact that bipolar depression is a war of the mind, while deep sadness and depression are becoming on the rise these days. Bipolar depression particularly is a mental war that some people may have to battle throughout their lives. These people are also forced to live at the extremes, and I say forced because it just seems like the ideal way to describe emotions that cannot be ordinarily controlled. Depression and mania come with extreme mood swings that require practice to effectively control. Something else a lot of people also do not realize about bipolar disorder is that it often comes accompanied. Anxiety disorder, social phobia, and weight problems are some other illnesses that a person with bipolar may have to face alongside their daily struggle with bipolar depression. For some others, there is a seasonal component to their symptoms, such that the manic and depressive cycles become pronounced during particular seasons or times of the year. But despite all of these, the biggest mistake a person with bipolar can make is deciding to hold on to the belief that nothing is wrong. Accepting the diagnosis does not equal allowing bipolar disorder to define every moment of your life. So, as I mentioned at the start of this video, I'm going to be sharing a few tips which can help you or your loved ones manage their symptoms. As always, I emphasize getting professional help. Like any other medical condition that requires a doctor's attention to improve, you should never undermine how much good can come from talking to a mental health professional. And maybe I should have started with this tip, but to manage bipolar disorder, you have to learn about it. Understanding what you are experiencing can be tough at first, but the more you read about it and educate yourself, you begin to understand that you are not alone, and that's when healing begins. Finally, do not be afraid to lean on a support team without feeling like a burden to the people who love you and want to help. These are the people that can help you stick to your healthy coping routines and would be there for you in times of emergency. Fighting and beating a mental illness is a battle that demands patience, so keep this in mind and you'll come out victorious. So, what did you think of today's topic? Sound off in the comments, and give this video a thumbs up if you found it helpful. Don't forget to subscribe for more content like this, and if you find this information useful, check out this other video from our channel too. Until next time, we wish you a happy and healthy day.